Good afternoon. My name is Marie Hargrove. My pronouns are she, her, and I am the Training Capacity Builder Coordinator for the New York State Coalition Against Domestic Violence. I would like to welcome everyone to NYSCADV's budget briefing for legislators and legislative staff. Before we start the presentation, I would like to go over some housekeeping items. We have live captioners with us today. If you would like to access the closed captioning for today's presentation, click on the closed caption button on the Zoom menu bar. We are recording this meeting for those who could not be here with us today. If you have any tech issues, please send a direct message to me, Marie Hargrove, and I will assist you. Shannon Wong, NYSCADV's Public Policy Coordinator, will be monitoring the chat for us today. If you have a question about the information shared today, please put it in the chat, in the Q&A feature, and we will address it at the end of today's presentation. With that, I'd like to introduce today's speaker, Joan Gerhardt, NYSCADV's Director of Public Policy and Advocacy. Joan?
Thank you so much, Marie, and thank you for your help in facilitating today along with Shannon. Welcome, everyone, to our annual budget briefing for legislators and legislative staff. We have a lot of exciting news in this year's budget with respect to domestic violence-related issues, so I'm really looking forward to conveying our reactions to the budget to all of you today. And just a little bit of emphasis on the fact that we are recording today's presentation in light of the fact that today is the public protection budget hearing, and there's a lot of activities going on in the legislature, in the Capitol. We wanted to be sure that staff and legislators who weren't able to join us today had an opportunity to review this webinar at a later time. So just again, an acknowledgement that we are recording today's webinar, and it will be distributed by link to legislators and legislative staff. So with that, why don't we review what we hope to achieve today? First, we want to give everyone a brief introduction into the New York State Coalition Against Domestic Violence. And then we want to give you a little bit of context with respect to important facts that you should know about domestic violence generally, and particularly about the prevalence of domestic violence in New York State. Then we'll wrap up by reviewing some very specific initiatives in the executive budget aimed at domestic violence, and one in particular that was not included that we wish would be. And following that, we'll spend some time for any questions and answers at the end of the presentation. But I'd like to encourage you, if you do have questions, thoughts, or feedback during today's presentation, please don't wait. Go ahead and put it in the chat box. Shannon will be monitoring all of the activity in that chat. And if there's something I can address during the presentation itself, Shannon will go ahead and interrupt me, and I'll talk about that as those questions arise. So as I said, let's begin with a brief entree into who is the New York State Coalition Against Domestic Violence, or fondly referred to as NYSCADV. So NYSCADV was established 45 years ago. We are a not-for-profit, and every state and territory in the nation has a similar domestic violence coalition. So the coalitions are designated by the federal government as the Information Clearinghouse and Resource Center for all things related to domestic violence. So here in New York State, NYSCADV serves as that Information Clearinghouse and Resource Center. And I just want to make a little bit of a distinction between NYSCADV and the State Office for the Prevention of Domestic Violence, which you might be familiar with as OPDV. So OPDV is the state agency. So it's a government agency that is also focused on elevating the needs of domestic violence survivors in the state. And their focus is on state agency work, state employees, and broad state awareness campaigns on certain issues. They also do some training for state workers and that kind of work. NYSCADV aligns with OPDV in that we too are focused on domestic violence, but we are a not-for-profit and we serve essentially the local domestic violence programs across the state. So those providers are our members. And we provide two types of services, generally speaking, for those programs. We provide education, training, and technical assistance for the staff at those programs, as well as the leadership of the programs as not-for-profit agencies. And we also do quite a bit of work on policy development, legislative and budget initiatives, and systems change work. And we do that work both at the state level as well as at the federal level. And our split is about 90% focused on state activities with 10% focused on federal. Now, as part of the work that we do on the policy team, we have a couple of annual advocacy days. Maybe you've seen us around the legislative office building in Capitol wearing our purple scarves. So we have two events each year. We have a budget advocacy day, which is coming up this year on February 28th. And we also have a legislative day of action, which this year is scheduled on May 14th. And both activities draw quite a number of advocates to the Capitol and legislative office building so that we can meet with legislators and staff to talk about our budget and legislative priorities for the year. We're also able, at least in the past, to have the chambers represent domestic violence issues by passing a number of DV-related legislation and passing resolutions supporting domestic violence survivors and the work of domestic violence advocates. So let's start by talking about what is domestic violence, because I think it's very important that we're all using the same terminology when we talk about domestic violence. And the important thing to remember about domestic violence is that it's a systematic pattern of power and control, and it's perpetrated by one intimate partner against another. So you might also hear domestic violence referred to as intimate partner violence. And the important thing to remember is that we're not talking about one incident. Someone who is engaging in domestic violence is engaging in a pattern of behavior. So this is multiple incidents and multiple tactics that are used to exert power and control over the other person. And it's important to remember that this goes far beyond physical violence. It can include things that we can't see, like sexual violence, threats, economic abuse, technological abuse. We're seeing a lot of now in terms of stalking, emotional and psychological abuse. And all of these things can contribute to very significant harm and injury to victims, including physical and psychological trauma, and of course, in severe cases, serious injury and death. So domestic violence exists and is actually quite prevalent in every community in the state, and it affects all people. There might be stereotypes about the type of victim who experiences domestic violence. I hope you wash your mind of those stereotypes, because domestic violence impacts people regardless of age, socioeconomic status, sexual orientation, their gender identity or expression, race, religion, nationality. It really cuts across all demographics. And I also want to point out before we move on that in terms of gender, 85% of domestic violence happens to women. So that's not to say that men don't experience domestic violence, they do, but the vast majority of victims are female. And that's because domestic violence is rooted in gender inequality and the abuse of power and harmful norms. So this is why we see domestic violence take on many forms, including sexual violence, but it also includes aspects of child marriage, female genital mutilation, and things of that nature. So when we look at the incidence of domestic violence, what we find is that on average, more than 10 million people are physically abused by an intimate partner in the United States. And for all of the statistics I'm going to talk about today, I've provided the references for you if you did want to look a little deeper into the stats. But essentially, domestic violence accounts for about 20% of all violent crime. So chances are everyone on today's call knows someone who themselves or their family have experienced domestic violence. 1 in 3 women and 1 in 4 men in the US experience some form of physical violence by an intimate partner. That's an astounding statistic. And those rates actually go up for transgender individuals. It's really 1 out of every 3 or even 1 out of every 2 transgender individuals who have experienced physical violence by an intimate partner. The cost of this violence to individuals in society exceeds $8.3 billion a year. And that's a statistic that was put together in 2007. Unfortunately, we don't have a revised figure, but I'm assuming it's gone up pretty significantly since that 2007 study was done. And that includes certainly the loss of wages for employees who can't work because, maybe they're in the hospital because of a DV incident, or maybe they're in court, to deal with child custody as it relates to domestic violence. So it crosses all of those aspects of a person's life and how that translates into societal costs. So what are we seeing in New York State? In New York, the statistics really aren't different than what we're seeing nationally. 32% of New York women and 29% of New York men report experiencing intimate partner violence. So that could mean physical violence, sexual violence, or stalking, at least sometime in their life. According to the latest statistics that we have from state agencies, in 2022, there were 61 intimate partner homicides in New York. And year over year, that's about the number we tend to see. I think in 2021, it was 64 intimate partner homicides. In 2020, it was 61. So we're hovering around that same number. We also saw in 2022 more than 212,000 protective orders entered into New York's Order of Protection Registry, and nearly 88,000 victims report DV crimes to law enforcement. Now, I just want to make one note about these statistics as it pertains to reporting to law enforcement and data that DCJS has about the incidence of domestic violence crime. We know from studies that about 50% of domestic violence victims turn to the criminal justice system to seek justice when it comes to domestic violence. That means that 50% of victims don't choose to report to law enforcement or seek justice from that same system. So when we look at data such as the number of orders of protection or how many victims report their crime to law enforcement, we have to keep in mind that there are just as many survivors who never report domestic violence to law enforcement. So these statistics are probably pretty low as an indicator for how much domestic violence is actually happening within the state. So this leads me to the first critical point that I'd like everyone on the call today to remember when you walk away next week, next month. This is what I want you to remember: that New York has the highest demand for domestic violence services in the country. Now, you might ask, how do we know that? We know that because we have a national organization It's the umbrella organization of all of the domestic violence coalitions across the country, called the National Network to End Domestic Violence. And every year, NNEDV, the National Network, does a survey on one day in September of each year, where they go out through the coalitions to all the local domestic violence agencies in the country to get information about the number of victims that they're working with and the types of services that they're providing. The reason why this is done on one day is because we recognize that domestic violence survivors may move from one community to another, either internal to that state, or actually move out of the state for services or to remain safe. So to ensure that the number of victims that are receiving services are not duplicated, that survey goes out and obtains information over a 24-hour period. So we're sure that we're not duplicating the count. And in New York State, on that one day in 2022, there were over 9,000 domestic violence victims who received services. And that was the highest demand across all of the states in the nation. Before you think that that's a blip, I want to reassure you that New York has had the highest demand for services over the last several years, even during the pandemic, despite the fact that New York doesn't have the highest population any longer, right? We're not the highest populated state. And yet we continue to have the highest demand. More important, we have the highest number of unmet requests for services in the country. So on that same day, the survey found that there were nearly 1,000 individuals, in addition to the 9,100 folks who actually got services. Nearly 1,000 more were seeking services and couldn't get them. And as you can see from the slide, 65% were looking for housing or emergency shelter. So we may not be able to meet the request because there might not have been an available bed and shelter, or they might have been looking for some kind of housing option that we couldn't satisfy. Maybe they were looking to obtain assistance going to court, what we call legal advocacy, and there wasn't an advocate available for that. Maybe they were looking for someone to help them find housing. So this is really important for New York legislators to understand that even though we talk a lot about meeting the demand of domestic violence survivors in the state, we're still not satisfying all the requests that local programs receive from community members. So we have seen an increasing demand for domestic violence services really since the pandemic, and that increase has continued. And this is for both residential and non-residential services. So New York State is a little wonky in how they fund domestic violence services. We actually separate funding for residential services, which is shelter and other housing options, from funding for non-residential supportive services. And I'll walk through what those are in a second. But I just wanted to point out to you that whether we're talking about requests for residential services and requests for non-residential services, both are seeing significant increases in demand. So from 2021 to 2022, non-residential service requests increased 41%, and requests for residential services jumped up 36%. So pretty consistent trend here of increasing demand. So generally speaking, when domestic violence survivors seek assistance from local providers in New York State, they're looking for residential services, which, as I said, is either emergency shelter, maybe it's a safe home if it's a rural community, or transitional housing that has supportive services tied to it in addition to the residential assistance. Non-residential services encompasses a wide swath of services that we're actually required by OCFS to provide. So that includes general advocacy with other community-based service organizations, state agencies, and programs. We provide counseling, which certainly involves crisis intervention and safety planning for the victim and their family. There's legal advocacy, and this is different than legal services. So, it could be if there is an attorney on staff at a DV program to assist in that way. But legal advocacy means helping victims navigate the legal system, hooking them up with legal attorneys, with representation, maybe accompanying that victim into court just to give them some emotional support. We support survivors with job training assistance and finding housing and childcare, certainly assisting them finding medical or mental health treatment. And we also function by putting victims together in support groups so they can learn and support each other, peer-to-peer mentoring, if you will, as well as the overall information and referral to, all of the various community-based organizations and, state agency accommodations that exist for domestic violence survivors. So every year we at NYSCADV have a number of pathways where we can obtain information and feedback from domestic violence survivors, as well as the advocates who work to support them every day on what their priorities are. And over the last year or so, what we've identified as the priorities of survivors include more of these one-on-one advocacy services, as well as group services like support groups and meetings. Survivors are looking for more legal services to assist them, particularly in family court. We're seeing unfortunate outcomes for domestic violence survivors in family court, where more of them are losing custody of their children, which is a dramatic concern for us. We're unable to satisfy the demand for mental health services. So in the last couple of years, to its credit, the governor and the legislature have been focusing quite a bit on the mental health needs of New Yorkers. This is certainly true for domestic violence survivors as well as the general New York populace. Unfortunately, we still have long waiting lists to manage domestic violence survivors up with mental health providers. So a gap in that service area for us. Supervised visitation and safe exchange programs. So just a quick definition for these two types of programs. Supervised visitation is a program that might be ordered by the court if the court is concerned that a parent or guardian has shown abusive behavior on either to the other parent or maybe to the child. And the court requires that parent who has exhibited the abusive behavior to only visit with the child in a supervised setting. So with a neutral attendee, at that visit, at a neutral location. A safe exchange program occurs when parents have access to unsupervised visitation with their child, but there might be a concern for the risk of one of the parties when that child goes from one household to the other household. So a safe exchange usually happens again at a neutral location where there's some protections in place for all of the parties. We see a significant gap across the state in supervised visitation and safe exchange programs. The Office of Court Administration actually completed an audit of supervised visitation programs in the state last year and found that 20 counties don't have supervised visitation programs at all. And then there are several other counties where those programs are pretty limited. Maybe there's access within a particular city in the county, but not broader within the entire geographic constraints of that county. So certainly more work to do there on supervised visitation and safe exchange. Victims are looking for more safe and affordable housing options and better training for judges, law enforcement, state agency personnel, and other systems representatives that they come in contact with. And that training on domestic violence is to ensure that they are working with survivors in a trauma-informed way and in a culturally responsive way. Now, I do just want to break for a moment because I see a question in the chat from Assemblymember Akis. Nice to see you here today, about the relationship between NYSCADV and a local domestic violence program like Fearless. Great program. Local domestic violence programs like Fearless are members of NYSCADV. So we are a member organization and we provide services to those members and represent their needs to the legislature and governor. Regardless of whether they actually pay dues to NYSCADV or not, NYSCADV is responsible based on our federal designation as the information clearinghouse to represent the needs of all domestic violence survivors and service providers in the state. So I hope that answers the question. So this actually leads to our second critical point, that considering the increasing demand for domestic violence services, New York State has to fully fund domestic violence services to ensure all domestic violence survivors get the help they need when they need it. So that means going to where they are, not requiring domestic violence survivors to come to us or come to the state, but we need to ensure that services are fully accessible and available to all domestic violence survivors when they need them. So before we move on to the executive budget, Shannon, I just want to make sure that there's nothing more in the chat that I should be addressing before we move on.
I haven't seen anything. I think it was mostly Assemblymember Akis's and if we're going to send stuff. So I think we're good to keep going.
Okay. And let me just remind folks, if you do have questions, please go ahead and use the chat and we'll be sure and get to them. So now I think everyone knows that the executive budget was released on January 16th, if I'm not mistaken. And now that the executive budget has been issued, the chambers, the Senate and Assembly will be coming out with their one house budget bills after obtaining a lot of feedback from their constituents. I know budget hearings are going on right now. And ultimately, the executive budget will be finalized into a final budget, hopefully by the April 1st deadline. So there are a number of things that I wanted to talk about with respect to the executive budget. First and foremost relates to the VOCA funding. You might have heard us talk about the VOCA funding. This has been an issue for victim service providers since 2021. I know it's almost been a full-time job for us here at NYSCADV to elevate the issues pertaining to VOCA. So in some shorthand, because we can't go into too much depth here today, but VOCA is a federal pot of funding. So it comes from Congress and it stands for the Victims of Crime Act funding. And that federal pot of money is divvied up and issued out to states like New York in a federal annual grant that we receive. That grant comes into New York and then is administered by the State Office of Victim Services and goes out to victim service providers under contract with OVS. And this grouping of victim service providers includes domestic violence agencies but is broader than that. It includes sexual assault, rape crisis centers. It includes child advocacy centers, legal services, legal service organizations that do work with survivors of all types of victims, as well as prosecutors, DA's offices, and some sheriffs and some other municipal entities who have victim advocates within their staff. So a very broad group of victim service providers get these subgrants, these focus subgrants, and the money is then used to assist hundreds of thousands of New Yorkers to access a number of different services, not the least of which is shelter, housing, legal services, counseling. It really does go on and on. Because of what's happening at the federal level, and again, I can't get into too much detail here in the time that we have, but New York's federal VOCA grant has declined $121.6 million since 2018. That's 61% of its value. And that's true for all states. So this isn't unique to New York. So this is a dramatic problem. And we have heard OVS warning victim service providers over the last couple of years that because of these declines, the contracts that it has with victim service providers are in jeopardy. Their most recent warning was that the existing contracts, which were coming up on our third year of the existing contracts, OVS was considering cutting $19 million out of those existing contracts. That would be a huge hit to this critical safety net infrastructure that New York has for crime victims. I mean, imagine cuts of $19 million across the state's infrastructure. That's not sustainable for these programs. And we'd likely see several providers, cut back programming or even shutting their doors, which would, have disastrous impacts for survivors. Prior state appropriations in the fiscal year 23 and 24 budgets covered only about 23% of the shortfall. For those of you who have been following this issue, these have been installments of $14.4 million in these last two budgets. Definitely helpful, but obviously not enough to prevent cuts on the existing contracts. The governor's executive budget includes a total of $134.4 million to protect the existing contracts, which is critical, and also prepare us for the next procurement cycle, which will be for contracts from 2025 to 2028. So this breaks down as $20 million for the existing contracts. So remember I said the cuts of about $19 million, $100 million for the next contract procurement, and the last installment of the $14.4 million that was committed in fiscal year 23. Now, the governor is also intending future appropriations of $100 million in the fiscal year 26 and 27 budgets. So that would mean in addition to this $134.4 million, $200 million more to support that next procurement. So it goes without saying that we were thrilled to see this in the executive budget. It's just the shot that we thought victim service providers need, and we are really urging the legislature to accept these appropriations in the budget so we can ensure the sustainability of victim services statewide. So now I'd like to move on to another initiative with respect to what the governor is calling the Domestic Violence Survivors Safe Fund. Now, we know that there's a very close link between someone's personal safety and their economic security. For many victims, concerns over their ability to provide financially for themselves and their children is what's at the basis of their decision to leave or stay with an abusive partner. Last year's budget created a new program allowing local domestic violence agencies to provide direct cash assistance to domestic violence survivors. And the program has low to no barriers to access. So we're not looking for perfect victims here, is my point. So there's no income eligibility, no geographic requirement, no workforce requirements, no requirements of any kind. Very little or really no documentation or paperwork on the part of survivors. So they don't need to show an order of protection or some other third-party attestation to obtain the financial assistance. Last year's money, unfortunately, isn't yet in the hands of domestic violence survivors. We understand that the state controller has just approved the program. So we're hopeful to see that money start to flow out to survivors pretty soon. It does have to be spent by December 31st, 2024. The governor included an additional $5 million for that program in this year's budget. So that would be a total of $10 million to support this critical program. And we're hoping, again, that the legislature accepts this appropriation. Now I'd like to move on to a line item that appears in the OCFS budget in the aid to localities budget, which has been set at the same level as far back as I went, which was 15 years. So essentially, we've already reviewed that the demand for domestic violence services continues to rise, right? Local departments of social services have a very instrumental role in funding the domestic violence programs that operate within their communities. So essentially, there's a couple of exceptions, but most county departments of social services contract with these nonprofit domestic violence programs for the non-residential services, as we talked about before. And then they also reimburse residential DV programs for shelter stays. So when a survivor goes into emergency shelter, the program provides that housing and any supportive services to that individual, and then seeks reimbursement from the county DSS for that shelter stay. Funding that the local departments of social services get is represented in one particular line item that's referred to as adult protective and domestic violence services, again, in the OCFS ATL budget. That has been level set for more than 15 years. It's been sitting at $44 million, like I said, for as long as I went back. This year's executive budget includes, I think, a first ever increase of $21 million to reflect the increasing demand that counties are seeing in terms of the need for non-residential services and the reimbursements for shelter stays. So we were really thrilled that the governor identified this increased need and reflected more funding flowing to counties to fuel the domestic violence services in their communities. And finally, with respect to earmarks within the executive budget, I wanted to bring to your attention that there's $24.5 million to implement the Fair Access to Victim Compensation Law, which was passed last year. So victim compensation is used to reimburse victims for crime-related expenses. So this is reimbursement that goes directly to the individual that experienced crime. And victim compensation can be used for a number of different types of expenses, like medical and funeral expenses, lost earnings or support, counseling costs, cleanup of crime scenes, or even repair or replacement of personal property. In the past, victims were required to report crime to law enforcement in order to obtain victim compensation. Excuse me. The Fair Access to Victim Compensation Law, pardon me, the Fair Access to Victim Compensation Law permits crime victims to have victim service providers, like domestic violence advocates, not police, support their application. And this is a huge positive change in that we know there are many victims of crime who, for a lot of reasons, are reluctant or not interested in reporting crime to law enforcement. The State Office of Victim Services, which administers New York's victim compensation program, anticipated that this change will result in a significant increase in the number of applications it receives. So the executive has included this additional money for OVS to implement the new law. So this will include additional staff at OVS to review the new applications, as well as significant amount of funding to respond to the applications and get the hands into more crime victims. So now I'd like to talk about the one area where domestic violence wasn't included in the executive budget, and we'd like to urge the legislature to reflect and focus on this. It might surprise you to learn that domestic violence advocates have never received a cost of living adjustment, period. So, even though domestic violence advocates are contained within the sector of human service workers, right? I think when we think about domestic violence work, we think about it as human services. However, when New York State created the designated group of human service workers that are characterized as the COLA group, domestic violence advocates were not included. That was done back in 2008. That was a statutory group that was identified primarily of services and service providers that fell under the Department of Health. Since that time, many of those services have become administered by different state agencies. So we now see some of the COLA human services administered by OCFS or OASIS or the State Office for the Aging. So there's a broader grouping of state agency involvement with the COLA. However, that grouping that was first designated back in 2008 as the groups that are eligible to receive COLAs never included domestic violence advocates. And we have been unable to get New York State to include domestic violence advocates in that group. So we have never received a COLA, nor have domestic violence advocates received any kind of wage salary increase or bonus. Now, as I'm sure you all know, domestic violence advocates perform essential work in New York State. This is not easy work. Advocates have grueling schedules This work is performed 24 hours a day, 7 days a week, and it can often be traumatizing for the advocates who do the work. It's also no longer a volunteer workforce. This work requires specialized training and education. People need to go to school and receive that training in order to do this work. And yet New York State continues to not value this employment, this workforce. Many domestic violence advocates do not earn living wages. Think about that. Many domestic violence advocates do not earn living wages. This has had a disastrous impact on recruitment and retention in New York State. According to a study that NYSCADV did, along with the New York State Coalition Against Sexual Assault, there were nearly 1,200 departures in 2021 and 2022 from our member programs, from domestic violence agencies and sexual assault rape crisis centers. This is unsustainable. We continue to see transition out of our agencies, and we're unable to fill critical roles and responsibilities within our agencies. This translates into long waiting times, long waiting lists for survivors, the inability to obtain services, not having an advocate with a survivor when they go to court, when they're looking for housing, when they're safety planning. This gets back to what we discussed earlier with the number of individuals, of New Yorkers who are seeking services in New York and can't get them. Now, I'd like to point out that Senator Prasad and Assemblymember Hevesi have introduced legislation, it's S7793 and A8437, to include domestic violence advocates in this COLA, in the statutory grouping eligible for a COLA. We are urging legislators to co-sponsor this legislation, and we're also looking to the legislature to incorporate this into the fiscal year 25 budget. So I'd just like to quickly wrap up I see we have about 10 minutes left, and I do want to leave time for questions and answers. This slide summarizes what we just reviewed: the money for the VOCA shortfall, the additional money for economic microgrants for domestic violence survivors, an increase in the adult protective and domestic violence service line item under OCFS, money to ensure the implementation of the Fair Access to Victim Compensation Law, and inclusion of domestic violence advocates in the governor's proposed COLA. We're actually hoping that the COLA also bumps up from 1.5% to something more in the area of 3.2%. So these are our main budget priorities. There are some other initiatives out there that are mentioned in the budget, but these are the items that we think are really truly aligned with what survivor priorities are. So with that, Shannon, I'd like to ask you, is there anything in the chat that we need to address?
Well, Assemblymember Ekus is on the bill, and people asked what the bill numbers were, so I think I put them in there. 8437 and 7793. Is that right?
That's correct. Thank you.
There are no questions in the Q&A, and I don't see anything else in the chat, but we've got a little time.
Yes, we will definitely stay here and see if anyone puts anything in the chat. In the meantime, I just want to let everyone know again the dates of our 2 advocacy days. Budget Advocacy Day is February 28th. We are also hoping to testify at next week's Human Services budget hearing. We have submitted written testimony for that. So if anyone is interested in seeing that, just let me know. Happy to circulate that. And I also did want to just let everyone get our email addresses, Shannon, you and myself. If anyone has additional questions or wants to provide feedback, please use this as a resource. We're here to help you respond to your constituents if there are domestic violence issues that arise. If you have ideas about legislation, we're always happy to jump on a call or come by your office to talk to you about those issues and see how we can best serve the needs of domestic violence survivors. So I
There's
see,
a
Chris. Yep. How can we advocate to help our local DSS share the money with all providers and just not one provider? Christine, that's a great question. I think that's a little community specific. So I'm happy maybe to take that offline and talk to you a little bit more in detail about fostering that relationship with the local DSS and finding out what's really at root there. Any other thoughts, questions, feedback? Must have done a good job today. So with that, I think we'll close out the recording and get that link around to everyone as well as the slides. I want to thank you again for joining us today. And please use this as a resource and stay in touch. Thank you.
Thank you all.
Letitia, I see your question about the micro grants for health related issues. Um, the micro grants that I identified for domestic violence survivors, those can be used for health related issues. There's really no restriction on how a domestic violence survivor can use that money coming to them. With respect to specific, trying to get in a line item in the budget specific to healthcare, that's a different thing. And we can certainly talk more about that. All right. Thanks again. We'll end today's webinar.